my name is Dawn Warfield, and I'm a student here at METC in the Administrative Assistant Program. I'd like to thank all of you for coming out to listen to my speech. The object of my speech is an ultrasound photo that was taken when I was 5 months pregnant with my son. I chose this for my speech because if you look closely in the photo, there's a bright spot that later led doctors to figure out that my son had tetralogy of Fallot, also known as TOF. TOF is a condition in which the valves in your heart are very, very slim, and it's hard for blood to flow properly, and eventually it makes it too difficult to breathe. Most cases, surgery is needed, and in my son's case, surgery was needed at 5 months old. Up until him being 5 months old, life was very, very rough for him. He was constantly sick with colds, he had pneumonia, he's had bronchitis, he was even in the ICU twice before he was 5 months old. So like I said, life was pretty rough. Doctors told me that it'd be better for him not even being child care before having surgery because he was more open to getting sick from the other children. So at 5 months old, I found out that he needed to have surgery at the Children's Hospital in Milwaukee. I was so scared because my son was extremely small, but I knew that he needed this to save his life. The surgery was done in January, and we had to drive up to Milwaukee to the Children's Hospital. And the drive was pretty hard because it was extremely snowy and icy, and I was just scared that we wouldn't even make it there for him to have the surgery. I was thankful when we made it, and it was one of the most scariest experiences for me when the doctor told me that I couldn't go back with him to have the surgery and it was time for me to sit in the waiting room. I was so glad my husband was there telling me just to be strong, we'd get through this, and we just needed to pray, which we did before and after the surgery. I was thankful when the doctor came out and told us that my son was fine and he pulled through the surgery. I cried so hard for so long. The week after that, he had to stay there in recovery, and I was so thankful that right across the street was a children's hospital, and we got to walk back and forth to see our son whenever we wanted to. And the families and staff at the Ronald McDonald House were so, so nice. I was so thankful we had someone like that and people like that to share our experience with, because most of the people in the house were dealing with the same things with their own children and family members at the hospital. The week after my son came home was pretty rough as well. He became addicted to morphine while he was in the hospital, which he was taking for pain, so I had to wean him off over a week's time on medicine, and that week was extremely rough. My son was extremely crabby and he cried a lot. The weeks following that, he became better. He was more active, he was more smiley, and we were starting to see the old him back. A few months went by and he was getting even better and even better, and by the time he was 1 year old, sometimes we even forgot he had the surgery. What reminded us all the time was the scar that's now left on his chest. And now he's 6 years old, and he's one of the most happiest, active little boys you will ever see. You'd never think that at 5 months he went through so much before even being able to walk, crawl, anything. He's went through a lot, and I'm so proud of him. I also have a 3-month-old now, and at my first ultrasound for her as well, we saw a bright spot in the picture, and I was so scared that I was going to have to go through this again with another child. But a specialist told us everything would probably be okay, but since we had one child with TOF, it would be best to watch her closely to see if she had it. She ended up not having it, and I was so thankful because I do not know what I would have did to go through another surgery with another child, not even knowing what the outcome would have been if she would have had it. So I can say that this picture is of great importance to me because every time I look at it, I think of what my son had to go through and how much he's overcame to even be here. And I'm very proud of him, and this picture makes me think of him all the time, and I'll always keep it. And when he gets older, I'm even going to explain to him how proud I am of him and how strong he was to go through something like tetralogy of Fallot and having surgery at 5 months old. And I hope that he just knows how much of a trooper he was and how strong he was. So I'd like to take this time to ask any of you guys, do you have any questions for me about my speech or about tetralogy of Fallot?
Hi, yes, I have a couple of questions.
Okay.
Like, after the surgery, like, if any medication, did they have to give him any medication? If so, what, and how much he taking it, if he's still taking it, if all?
He took medicine when he first came home that was only to wean him off the morphine from the hospital. But after that, as of right now, he takes no medicine. He doesn't have to take anything right now. But once a year, he has to see a pediatric cardiologist for the rest of his life that checks his heart, gives him echoes, does tests, and he makes sure that everything's fine, and he's the one that will tell me in the future when and if he'll need a surgery. With the new technology that's out now, I'm hoping that when and if he does have to have another surgery, it will be something a lot simpler than open heart surgery, maybe an injection through the leg they mentioned or something like that, because at the age he is now, I do not want him to have to go through what he went through before. So I'm hoping that we just keep going every year and things will keep looking good for him. Does anybody else have any questions? Alright, thank you, and I'm glad you all got to listen to my speech, and I'm glad you took the time out to listen to what was important to me. Thank you.
How long?